Hello, good people. How are you today? So, I am at a different location today, so I thought I would just pop in really quick and do this video. So, today is June 10th, which makes it the 10th day of Uterine Cancer Awareness Month. So, that's 10 days of me posting very valuable information. As a uterine health advocate, I think I feel it is important for me to align myself with this awareness to provide, as much information as possible to talk about uterine health and uterine cancer, and of course, all things having to do with our uterus, excuse me. So I also want to say thanks so much for always, viewing the videos, subscribing to the channel, commenting, liking, and things of that nature, and sharing the video. I really do appreciate that as well. So I'm kind of nervous because I'm in public. I don't like to be in public, like filming. But anyway, I just want to also say that I am not a medical doctor. I am a uterine health advocate, and my full disclaimer is in my bio. So today, let's get right into it. I want to speak about HRT, which is hormone replacement therapy. I briefly mentioned HRT regarding an article I added yesterday for how I put articles for references, and I happened to mention that one may speak about HRT, and I didn't know much about it. So today I decided to just do some a quick talk about it, and give some insights about it. So I just wanted to, also have this as a reminder that on this channel, I share high level bullet point information. And my hope is that you will gain information about each subject that I present to you that will encourage you to do your own research, as we all are different. So these are just high level bullet points, and you may have something that is a little more unique to yourself. So hopefully this encourages you to go ahead and do your own, research. I do believe also by having these kind of, topics presented to you, it helps you have a better conversation with your medical professional, your medical doctor, and even your insurance agency companies that you deal with. So I hope that by providing you with more information, it also empowers you to strategize and build a healthy journey for you in your life, because we're all unique and we're all different, and we just have to be able to make, good decisions for ourselves. So HRT. So HRT stands for Hormone Replacement Therapy, and throughout the video I'll be referring to it as HRT. And this is a medical treatment that supplements or replace hormones that are naturally produced by the body when the levels are too low or missing entirely. So it's a replacement therapy. Hormone replacement therapy addresses multiple symptoms simultaneously by targeting the underlying conditions. Which is pretty much unpredictable at times because our hormones can fluctuate as well. So, depending on the medical contact and what's going on with your body, HRT is used for several different purposes. So, let's look at that. So, menopause is the common purposes for an HRT. This is the most common use for it. As women approach and go through menopause, our ovaries produce significantly less estrogen and progesterone. And some of the symptoms that HRT treats is hot flashes, night sweats, vaginal dryness, sleep disruption, and mood swings. And the types you can have is it can involve estrogen alone, usually for those who've had a hysterectomy, or you can have a combination of a HRT which has estrogen and progesterone in it. So there's the type. So it's estrogen alone, or you can have the one that has both estrogen and progesterone in it. So that's the types of HRT. The delivery methods you can have, there's pills, there's skin patches, there's gels, there's spray, there's a vaginal ring, and there are creams for HRT. And so some of the benefits beyond symptom relief, it says it helps prevents bone loss and reduce the risk of osteoporosis. And as you know, as we get older, we do have a high risk of osteoporosis. And some of the risk of HRT depends on the dosage and the type. HRT can significantly increase the risk of blood clots, strokes, and gallbladder issue, it says. So we can see that HRT is mainly used for, or most commonly used for, menopausal when women have significantly less estrogen and progesterone, which is what our ovaries produce. So some of the indication that you might benefit from HRT includes if you have hot flashes, night sweat, disruptive or poor quality of sleep, you have brain fog, you have fatigue, you have a low libido, you have mood swings, you have skipped or irregular periods. You may also need, they say, HRT if you've had your ovaries surgically removed, if you have hormonal or ovarian conditions, and you are experiencing menopause before the age of 40. So these are some of the things to look at. One second. Somebody was getting off the elevator, so I wanted to pause. So I just want to tell you that. So I also want to talk about some of the risk and side effects of um, HRT. They says that while HRP effectively treats menopausal symptoms, they do have drawbacks, which include a slightly elevated risk of severe conditions like blood clots, strokes, breast cancers as well. Breast cancer, I should say. Users of HRT also frequently experience side effects like breast tenderness, bloating, and headaches. And there's what three significant downsides depending on your medical history. It says your age and whether you take estrogen alone or the or combined estrogen and progesterone. Like I said, the blood clots and the strokes could happen. They said long-term use of HRT has a slightly increased risk of breast cancer, uterine cancer as well. If women still have their uterus and they're taking estrogen without progesterone drastically increase the risk of uterine endometrial cancer. So it says it also can lead to heart disease if you're taking HRT more than 10 years. But let me throw a note in here right now, a caveat. These issues that these points that I just pointed out, which talk about heart disease, uterine cancer, breast cancer, blood clots, and strokes, and everything like that, these came from a study that was done in 2002 that has now been challenged to be not true. Right? You hear all of these things, and now there's challenged to be not true. This is why I strongly, strongly urge you to, when to speak to a medical professional and do really good research. If you're online researching, you got to ask more than one question. You have to ask specific questions and dive deeper. Like I did. I said, are doctors still prescribing HRT in 2026? I asked that question. What are the pros and cons of taking HRT? What type of HRTs are there? And what is HRT? You can kind of ask specific questions. How does HRT affect me as an African American Black woman? Ask these questions because, as you can see from these things from a 2002 and we're now in 2026 study, the internet will have you dead. Heart disease, you think you got uterine cancer, breast cancer, blood clots, and strokes. That's why you have to be on your game and really ask good questions, to your doctor, because they should be at least, a little more updated in medicine. They should be, know what's going on in the industry. If they're your gynecologist, they should know what's going on with things regarding the uterus. And you can also ask these questions, which is why it's so important to have these topics and these conversations brought to light so that you can do more research, and maybe it might prompt your doctor to do more research as well. But I wanted to let you know that, I had a little note here that I thought about it, even as our phones and always has an update. Medical has an update too. When you think about it, there are things that our parents and our grandparents and our ancestors died from that now we may take a pill for, that now we may take a shot for, that now we may just have one procedure and we're healed from it, or we just change our lifestyle and different things of nature. So knowing that things have changed is great. So we don't have to live off something from 2002 that they say now is not true, and they have better research out there to combat that. So, but you don't see that if you just do one simple internet search about the risk, because if you listen to the internet, you're dead. You got cancer and all this other kind of stuff. So do your research, and of course, talk to a medical professional. Of course, I have some articles for reference that I'm going to put in the description. The first one is from the University of Utah. It's entitled Hormone Replacement Therapy, and it gives a lot of good information. This one I thought was kind of interesting. It's from Forbes magazine, which is a financial magazine, but the article is the best hormone Hormone Replacement Therapy of 2026. So I think it lists like the top 10 hormone replacement medications that you can take. So I thought that was pretty interesting that the magazine had that, but it's nice to know that they take an interest in women's health as well. The third article is from the Mayo Clinic, and that's from May 2025. Hormone therapy, is it right for you? The next one is from Tryon Medical Partners. That is entitled HRT Explain What Are the Signs You need. I'm sorry, it's HRT. They explain what are the signs you need for hormone replacement therapy. And then the next article is from NHU, I do believe, NHS, sorry, and it's from a organization in the UK, and they said they updated it in 23 and also updated it in 2026, and it's the benefit and risk of hormone replacement therapy, is what it says. The sixth one that I've added is from the Breast Cancer Research Foundation. Hormone replacement therapy and breast cancer risk. What is the latest research? What the latest research reveals, which might be a very good one to have, but they don't have dates on it. I wish they would put when they came out with this. So if that old article came out or research came out in 2002, when did this one come out? So that would be very helpful to know. And the last one that I have here is from the Yale School of Medicine, which was from April 2025. It says, after decades of misunderstanding, menopause is finally having its moment. And it does speak to HRT in this as well. And I think it talks about the latest findings and updates of why the 2002 study really wasn't as I guess it's not as valuable as it was back then. So I do appreciate all of the scientists. I appreciate people participating in studies, that we can have this updated information and we can, plan better for our future and what we want to know. So again, when you have those symptoms that I listed, that doesn't mean that you need to get on HRT immediately if you're having a hot flash and night sweats. It's really up to, what is your ovaries producing and how much of the estrogen and progesterone is it producing, and then to ask proper questions to your medical care professional. So I hope that was very informative to you and just gave you, again, like a high level view of what HRT is and its purpose for us as women. So until next time, I hope that you're having a very great day, and I hope to talk to you soon on day 11. Take care.